So all the rapid antigen tests that schools need to conduct that surveillance testing are available in schools for the next couple of weeks, and then we'll continue with the delivery of rapid antigen testing test kits over the next couple of weeks. So we provide the supply for that 4-week period. Masks continue to be mandatory for grade 3 and up, and as we've already announced, the mandatory vaccination for 3rd dose. So we're doing everything that we can to make sure our schools are safe as they possibly can be, because we know that the best place for our students is right here at school, face to face with their teachers, with their peers and friends. Can I acknowledge everyone who was with me, my friend and colleague Martin Foley, who is the state member for Albert Park in this context, so a very happy local member and a huge advocate for schools in this growing region, in this exciting project that is the Fisherman's Bend redevelopment. We also have Josh Burns, federal member for McNamara, Principal Anne Stout, and most importantly, the students behind me who make up the Year 7 cohort for Port Melbourne Secondary College. Can I take you through the COVID stats for the day? So 38.9% of Victorians 18 and over have had 3 doses, up from 38.1% yesterday. More than 2 million Victorians have had a 3rd dose, but that means roughly 2.2 million are eligible for their 3rd dose and have not yet had it. And this is really critically important. 16,298 doses were delivered yesterday at state sites, and more through our partners in our GPs and pharmacies. There are currently more than 250,000 bookings available for people 12 and above through state sites over the next 30 days. And as always, we'll add more appointments when those are taken up, and walk-ups are available too, so please check online for those sites. In terms of child vaccinations, 5 to 11, 3,045 children got their vaccine through state-run centres yesterday. 252,979 children aged 5 to 11 have at least received 1 dose to date. 96,426 of those doses were delivered in our state-run centres, with the remainder delivered through our 1,200 GPs and pharmacies. So that's 44% of that age group who have had 1 dose, up from 42% yesterday. And remember that this age group only became eligible 3 weeks ago. So this is a huge effort, and I want to thank parents, carers, and the kids for going and getting vaccinated. We've had good growth over the last few days in particular, but we've got to keep going, particularly because we've got an 8-week interval between 1st and 2nd dose. There are 81,000 appointments available for children aged 5 to 11 in our state-run centres over the next 30 days, and many more available through primary care. 30,000 of those appointments are available in the next 7 days. So there are thousands available at the Royal Exhibition Building, the Austin Repat Hospital, the Campbellfield Ford Complex, Sunshine Hospital, Melton Bunnings, and the Geelong Ford Factory. And you can walk up at 7 sites, so go to coronavirus.vic.gov.au for those details. In terms of people with COVID-19, 873 people are in hospital. That's down from yesterday's 889, and the 7-day average of 963. 102 people are in ICU. That's down from 111 yesterday. 33 are on a ventilator, down from 35. Sadly, we are reporting 8 people with COVID have passed away. In terms of case numbers, 6,485 people reported their positive rapid antigen test at the website. A further 3,568 people received a positive PCR result from 20,859 tests processed. That gives us a total new case tally of 10,053. The 7-day average of new daily cases is 12,422, and there are 76,335 active cases across the state. So they're the COVID numbers for you today. But again, before I hand over to our local member here, Martin Foley, and then we'll hear from Principal Anne Stout, this is an incredibly exciting day for for students in particular, for parents, for carers, for our principals, our teachers and staff, to be back at school day one, term one, with all of the COVID safe measures in place. And we're here at a magnificent brand new school, one of 14 brand new schools that are opening this week. And you know, that's a great credit to the architects and the builders. Through the challenges of COVID, we've been able to get these schools up and running for the start of term. A stunning vertical school, competition grade gym, science, technology, engineering, maths, the arts, robotics, fabrication. It is a brilliant school to offer students everything that they need in their secondary schooling. We are well on our way to delivering the 100 brand new schools that we promised by 2026. We're now up to 48. So I'm incredibly proud of what is the biggest school building construction boom in the history of the state of Victoria, and we're not stopping. There's many, many more schools to build and many schools to upgrade. But congratulations to Anne, the leadership team, and all the students. I'll now hand over to Martin to say a few words, and then we'll hear from the principal. Thanks, Martin.
Thanks, James. Schools are really the beating heart of local communities. And here in Port Secondary College, we've got such a fantastic example of what schools can be in a built form, but what they can mean to their community. The Fisherman's Bend Urban Renewal Precinct is the largest urban renewal project in the country, and to have this social infrastructure built early and delivering quality education, quality public school education for the future is a testament to the great work that not only the school leadership have put in, not only the builders have put in under really challenging circumstances, but the wider commitment that James has outlined to 100 new public schools being built over the coming years, 14 opening right now, and here in Port Melbourne, here in Fisherman's Bend, to have this brand new school led by such a well-regarded and deeply admired educator as Anne and her team, that reflects the aspirations of this community in world-class facilities. I could not be more proud. Can I thank James and the Victorian School Building Authority? Can I thank Hutchinson's, the builders? But more importantly, can I thank the families and the students and wish them the best as they start their journey here at Port Melbourne Secondary College, here in the heart of Fisherman's Bend, to build a new school and a new culture, and to really get this school off and running. This is a milestone day in our local community, and I commend everyone and I wish the good ship, Port Melbourne Secondary College, every success in her journey. And I ask Anne Stout, the Foundation Principal, to say a few words.
Thanks, Mike. Well, welcome to Port Melbourne Secondary College. It's an incredibly special day for us today. As you can imagine, we have 80 Foundation students who are very excited to begin their journey at Port Melbourne, and it's a thrill for us to be here and have all of you here with us today. I'd particularly like to thank Minister Foley, Minister Burns and Minister Merlino, our Deputy Premier, to be here with us on this really special occasion. For us to be one of the early organisations in the new Fisherman's Bend precinct is particularly special. We have been warmly embraced by our local community, and our families and local business have been excited to see us develop here and to watch the building grow. It's been a busy couple of years, and despite COVID, we have ended up with this amazing building, finished slightly ahead of schedule, if I can say that, which has meant that we've had a chance to settle into the school a little bit earlier than we might otherwise. So it's a real privilege for us to be here in the new innovative precinct of Fisherman's Bend. And we look forward to being an integral part of the community here as Fisherman's Bend grows. So thank you all for coming to join us on this really impressive morning for us. We're super excited to be here. Thank you.
Terrific. Thanks, Anne. Happy to answer any questions.
Minister, 44% of children, younger children, have had the vaccination. That's obviously more than half who haven't. Are you satisfied with the pace of how that's happening, or would you like to see it pick up?
I'd like to see it taken up as quickly as possible. And I've spoken a number of times of the really critical window of opportunity that we have in the Southern Hemisphere. If we can get our kids vaccinated, double dosed, before we head into winter, that is going to be critically important. So I was really encouraged about the last couple of days. Today we're at 44, day before we're at 42%. That's good growth. We had our 15 pop-ups open at the weekend. Great response there. We've got a further 15 pop-ups next weekend. We've got support from our GPs and pharmacies who really encouragingly came on board to deliver in-reach vaccination in schools. So a further 158 schools will participate in that, and we'll ramp that up towards the end of this week. But we're really encouraging parents and carers, encouraging kids to get vaccinated. It's just so critically important. You know, we're at a position today where we can deliver on our commitment to get schools up and running day one, term one of this year. And that's off the back of incredible support by the broader Victorian community to get their first and second dose. But it can't end there. The third dose for 12 and above and the paediatric vaccine are critically important. But to finish the question, it's important not just in terms of children getting vaccinated, but it's important also what we are doing within schools to provide comfort and confidence to our students, to our staff, to our parents and carers. And that's about the air purifiers, the rapid antigen tests as part of the surveillance program, the masks, the mandate for third dose for teaching and other staff. They are all part of how we can make our schools as safe as possible.
The Premier foreshadowed last week that getting kids back to school was going to be messy and it was going to be challenging. What are some of the, problems that you're expecting to see out of term one?
I think the biggest challenge will be in relation to staff absences, and we're seeing that across the board. Martin's seeing it in our health system with, any given day, thousands of health workers who are unavailable. We're seeing it in hospitality, any industry. We can see that the impact of the Omicron variant, primary close contacts, those who are positive, we're going to have staffing challenges, and that's why it was so critical to establish a pool, a job opportunity pool of retired teachers, retired PRINs. We've got about 350 teachers. We've got almost 30 former principals who are there able and ready to support schools if they do face some challenges in relation to staffing.
So there's no statewide return to remote learning on the cards though, but in the case of, isolated outbreaks, cases and so on, what resources will be available for students who are forced to miss school?
So in terms of remote learning, that's an absolute last resort for a particular school who are having significant challenges with staffing, for example. So those students who are at home, whether they're isolating or whether it's in relation to a very short period for that school of remote learning, teaching and learning materials will be provided, activities will be provided to those students. But in terms of statewide remote learning, in terms of broad-based remote learning, we are beyond that. It's all about getting our students back to face-to-face learning in front of their teachers, with their peers and friends. We know for their social and emotional well-being, for their education, we want this year to be as low on disruption as we can possibly make it.
Do you know how many teachers are isolating on day one of term one?
Look, we'll get those figures over the course of the next few days. But we had teachers at most schools back on Friday of last week. There were no reports of significant problems. So we'll see how the course of this week goes. But the Premier's right, and we've been saying that there will be challenges and there will be bumps over this first few weeks, and that's why the surveillance testing program is just so important.
6.6 million rapid antigen tests, I believe, went out over the last few days to schools. How is the supply chain for what happens after those? Is there enough to keep them arriving?
Yeah, so we've got the full complement will be rolled out of around 14 million rapid antigen tests, and that's all that we need to deliver surveillance testing for the first 4 weeks of school. So more than 6 million are already at schools today. So all the rapid antigen kits that that parents need for their children, that staff need for surveillance testing. All of those kits are available, so we've got enough for the next couple of weeks, and we'll continue to deliver. So we've got the full complement of rapid antigen kits for the next 4 weeks of surveillance testing. And I do want to give a shout out. You know, you don't see them at events like this, but the drivers, the transport companies, they have been extraordinary. My department's been working with a number of transport companies to deliver the air purifiers, to deliver the rapid antigen kits. We'll now move to deliver tens of millions of surgical masks, as well as the next round of rapid antigen tests. We had a number of transport companies who had real challenges with staffing, drivers who were absent. They just pulled out all stops to get this done, and I really do want to thank all of the drivers and the transport companies who have been brilliant.
What was the cost of this school?
The cost of this school was around $74 million. I'll get you the exact figure. It is a reality that when you build in the inner city, vertical schools going up, they generally cost more than a greenfield site in the outer suburbs where it's a single story construction. But this is, you got to remember, there were no vertical schools, vertical government schools, when the Andrews government came into power. We've now got 8, and there's more to come. This is a brilliant school, and as Martin said, you know, you can't create a sense of community until you have fantastic social infrastructure like schools, and this is one of the jewels in our crown.
Can I ask the Health Minister a couple of questions just about our numbers today? We're hit 10,000, so the case numbers are falling, our hospital numbers are falling. How are we going on the code brown and potentially removing it?
So we welcome the direction that we're on as we seem to be coming off the peak, but we have to tread carefully and cautiously. As we've indicated, with 1 million kids moving around and coming back to school, with significant numbers of tests underway, we're likely to see a whole heap of cases that we're unaware of being identified, so we're likely to see cases go up. But equally, as we see that increased movement, it will be those families and the home-based environments that might well see a tick up as cases potentially increase. We know that vaccines are the solution to that issue. We continue to see a disproportionate number of either unvaccinated or under-vaccinated Victorians appear in our hospitalisations, our severe illness, and tragically our deaths. Our hospital system continues to be stressed and working extremely hard and beyond the expectations of what anyone's living experience about the demands in the system have been. That's why the Code Brown was declared. We monitor it every day, and we're not going to keep it on for a minute longer than we need to, but at the moment the system continues to be operating under huge stress, successfully but stressed.
And when it comes to the booster rate, we've seen that move quite slowly. Jerome Weimar admitted as well that there's not a big rush to get the booster. Are you hoping that now children are back at school and things are getting back into routine, that you'll see that number start to tick up?
Vaccines work. Vaccines keep you out of hospital. They keep us open. They keep schools like this able to be operating. The most important thing we can do is to come forward when you are eligible. As the Deputy Premier indicated, some 2 million Victorians, as a result of bringing forward from 4 months to 3 months the booster interval, are now eligible. And whilst we've seen solid numbers, there are more Victorians out there who need to come forward either to state-run clinics or the hundreds of community pharmacies and general practices who are out there ready, willing and able to get us fully vaccinated for that 3rd dose and to allow us to drive this Omicron variant down and to be positioned for the next challenge that the global pandemic might deliver us.
Is there any word on when 12 to 15-year-olds will be eligible for a 3rd dose?
So that's a matter for both the the various Commonwealth regulatory bodies, whether it be the TGA or ATAGI. We did see last week both the TGA indicate that 16 to 17-year-olds would now be eligible. We're awaiting advice from ATAGI, the Australian Technical Advisory Group on Immunisations, as to what that will look like. The state-run clinics, together with primary care and primary health, are all ready to go. In regards to 12 to 15-year-olds, my understanding is that the TGA are considering that, and we would encourage the TGA to work through those issues in a timely way and get that group also into the third booster group.
I just have another question for the Education Minister.
Excellent.
On behalf of the ABC. Kahuna Secondary College in the States North says it has 36 rapid antigen tests despite having a cohort of 195 students and 40 staff members. Macedon Rangers, Kyneton High School says it has 76 tests. When will more tests arrive at those schools, and why won't enough delivered before the start of term?
Well, the commitment that we made was that we'd deliver all of the rapid antigen tests that are required for the next 2 weeks by today, and that is exactly what is happening. So I know for a fact there are deliveries being made this morning. So a further couple of million deliveries today. The program is all about surveillance testing twice a week. So the commitment was to get 6.6 million this week. We've got more than 6 million today. So that means today at every single school, all of the rapid antigen tests that they need are being delivered already or by today. So that won't stop there. Then we've got the deliveries of rapid antigen tests for the second 2 weeks of this 4-week program. So I'm happy to chase up in detail those particular schools, but I know that there were schools I was being advised that were being delivered 9 a.m, 10 a.m, 11 a.m. today.
I have just one question on the tennis. The tennis final last night, whoever wants to have a crack at that one.
Former sports minister.
So a lot of vocal support for Rafael Nadal last night, but also quite a lot of booing for Medvedev. What did you make of the booing?
I think we should celebrate. You know, it's been difficult to hold major events over the last couple of years. The Australian Open this year, Ash Barty, Rafa Nadal with his 21st Grand Slam, and a doubles final in the men's with two teams of Australian players. So a brilliant couple of weeks. We have seen some behaviour. Look. I generally, when I go to a sporting event, I don't like to boo. I like to encourage my team or my players. That's what I hope people would do, but you know, people make their own choices.
Can I ask the second member a question if that's possible? Yeah. I know politicians don't always like commenting on news polls, but this one is going in your favour. So what do you make of that news poll today?
Well, I think that unlike the Prime Minister's office and the Treasurer's office, where many people will be freaking out about that poll, we only have one poll that matters. And last week we heard from Anthony Albanese, where he outlined a plan to help support state governments to get kids back to school safely. It's a consistent program of work that's focused on policy about what we can do as an incoming Labor government. And I think that the Prime Minister is being worked out by the Australian people. He's a guy who likes to tell everyone about how good a job he's doing instead of actually doing the job he's meant to do. So there's only one poll that matters, and we'll keep working hard until that day.
Do you think meetings like the one he had with Grace Tame hurt him with the Australian people?
Look, I think the Prime Minister, his character is being worked out by the Australian people. And I think the more the Australian people see of the Prime Minister, the less impressed they are. And it's our job as the alternative government not to just be focused on him, but also to offer a consistent policy and policy across all areas of government to outline the sort of future we want. We've got to tackle climate change, we've got to tackle the gender pay gap, we have to tackle workplace safety and culture, including at Parliament House. So there's a lot of work to be done, and that's what we're focused on. Thanks.
All good. Thanks, everyone.
Very good.
Thanks, kids. So was that hanging?
Thank you.
Yeah,